Hi, I'm Dr. Theeva. Thanks for having me here today. I'm a general, upper GI and bariatric surgeon.
Hi, my name is Emerald Dasani, but you can call me Emma. I am the relationship manager for Amden Capital.
IGB or intragastric balloon is an effective weight loss method where it's a balloon which sits in the stomach and it occupies about 2/3 part of the stomach. So instead of food occupying the stomach, it gives a false sense of the stomach being distended with something. So the hunger feeling is very much reduced. And the other thing is there's this hormone called ghrelin, which is secreted in the stomach when the stomach is empty. So it's a hormone signaling the brain, which says, my stomach is empty, I need to eat. So this ghrelin hormone will not get secreted when the balloon is sitting there because, it's giving a false sense of the stomach is being full. Yeah, so the sense of hunger or appetite will be reduced. The amount of weight loss expected with balloon is about 5 to 10% of your body weight. It can go up to about 20% if you couple it with lifestyle changes. Okay, it is an effective weight loss method in the spectrum of the many types we have. Yeah, so we have, of course, lifestyle at the end of this one spectrum, and then followed by medications, and then you have the balloon, and then you have surgery. So of course, compared to surgery, it's a slightly lesser amount of weight loss expected. However, it is still an effective weight loss method for some people. So ideally, the patients who we would recommend for intragastric balloon would be the category of body mass index or BMI between 30 to 40. Okay, because the weight loss they need is not so much compared to the higher BMI group. However, in this category, of course, if they choose to have surgery done, it's also suitable. The other category of patients who are suitable to have the intragastric balloon are patients who have the higher BMI, i.e. BMI more than 40. However, they are still hesitant to take that step towards surgery. So they want to try with this first. It's more of a bridging method or a step-up method before going into the surgical pathway. In terms of major contraindications, we will be concerned if patients, for example, they complain of severe GERD issues, so reflux issues. So if they have severe reflux issue already, then balloon may not be suitable for them because balloon is the feeling you get, okay, where you're feeling full. For example, what I can say is if you go for a buffet, okay, if you go for a buffet, you need to eat everything, you need to try everything. So after eating for that certain period of time, you'll feel that fullness, right? And some people they need to open up their buttons, okay, to feel better. Yeah, and you feel a bit of regurgitation or reflux, so that feeling you will be having it 24/7. Okay, whereas after the buffet it will all settle down after about 4 to 5 hours. However, with the balloon you will have that 24/7 feeling. So if you have severe GERD issues or reflux issues, then it may not be suitable for you. Apart from that, it's generally quite well tolerated. Okay, so in terms of benefits, I've already mentioned with regards to the weight loss. Expected weight loss is about 10 to 20% of your body weight. In terms of risks, also I've mentioned with regards to the reflux issues. The other rarer, uncommon complication which can happen is if the balloon bursts or the balloon gives way, then it's not a severe complication in terms to the patient. The patient will just feel the hunger coming back. So we need to put a scope in and have a look, see what's happened. The other thing is if the balloon bursts and then it goes down into the usus, into the small intestine and blocks. the intestine, then we will need to fish it out. If we can't fish it out through the scope, then the patient may need an operation. However, this is extremely rare to be encountered in clinical setting. So in terms of intragastric balloon in Malaysia, we have two types of balloon. Okay, one is balloon telan. Okay, where it's a pill which is about this size. Okay, you swallow it. It's done under daycare, and we take serial X-rays to make sure the balloon is in there before we inflate it with the solution we have. And the patients can go home the same day. The other type of balloon is done through endoscopic means. So patient needing a scope to put into the stomach and then to remove it as well through the scope. Okay, so so the procedure itself, it's probably about half an hour for both types of balloon. They both have their pros and cons. Okay, and it just depends on what the patient wants and needs for their weight loss method. And in terms of recovery, it's within a week. Okay, so we usually tell the patients, we give them about a week for them to get used to their their new sort of situation they are in terms of the balloon sitting in the stomach. But after that 1 week, they should be okay. So in terms of how successful it is quite successful. Coupled with the medications we give the patients to tolerate the side effects. So common side effects patients encounter would be nausea, vomiting, and regurgitation or reflux. Yeah, so this will roughly last for about a week until your body get used to the balloon sitting in the stomach. In terms of how successful post-procedure, it depends on the patients. They need to follow the doctor's advice in terms of the diet, the do's and don'ts, and also couple it with their lifestyle changes. Yeah, so in terms of exercise and their diet. Okay, in terms of the diet specifically, they will be put on liquid diet first, and then slowly introduce soft diet and then normal diet. However, they need to be careful in not taking sweet drinks. Yeah, because the balloon, it works in a way to reduce the amount of solid food intake. However, it does not stop liquid diet. Okay, so if you are a sweet drinker, yeah, if you have your coffee, tea all full of sugar, soda drinks full of sugar, then the weight loss is not going to be very obvious.
After post-COVID, spending habits already change. So with medical financing, it could help the patients or our clients to manage their financing much better. So that's where we come from. So rather than you use your credit card or your cash in one lump sum for the treatment, so with medical financing from us, you can pre-plan for the surgery. So you can manage your financial better. Like I mentioned, they can pre-plan, so they can manage their financing much better. So with our financing, we do direct debit. So we will only deduct the payment from your current or savings account as per agreement. It could be up from 6 months up to 5 years. So according to your preference, your lifestyle also, so which one are much more better for you to really spend and will be relaxed in going further for your trip. Okay, our process is very, very fast. Within 1 working day, we can give pre-approval already. And after signing the agreement, we can already disperse to the facilities within 1 or 2 working days also. So because we understand the importance of medical matters, so overall from day 1 until perhaps the day 3, we already can disperse the money to the hospital, so your patient can already get the treatments needed. So it is very fast. Yes, because our tenure is minimum 6 months up to 5 years. So when we talk to the patient, we will ask and look at their capabilities, which one are much suitable for them to really go ahead with the agreement. But let's say they go up for 5 years for the agreement, but after 6 months minimum, they wanted to settle it off, we're going to give rebate. So there is no penalty. From the feedback we get from our clients, what they really say thanks to us, because we do not practice the penalties. Okay, so if any problem or anything, they can always come back to us to discuss. Right now, for the past 5 years in doing medical financing, we have zero bad debts. So how we manage our clients is because we have a very good relationship with our clients. We try to understand how we can really cater for them to get the financing, because we know when people come to us for the financing, they really need it for the treatment that they're supposed to get it in the shortest time. So that's why with Amden Capital, the most I could say what's best about us is the time essence. There's no penalty, there's no guarantor, there's no upfront payment. So we are different from other institutions. Normally we have our ways. We will call and talk to them, try to understand why their payment is a bit late.
More humanized lah.
We make, actually our financing is what we call emotional financing. We do not simply just orang kata bagi letters ke or surat amaran ke. We try to understand what's the situation, because when people come and to Amden Capital, memang they need it for the medical matters. Our financing is open to most of medical procedures. So you could say, let's say from IGB, we can say from bariatric, even plastic surgery, maternity, confinement, hair transplant, and many more. So I cannot list down everything. It's just that we could cover most of any medical procedures, elective or non-elective. So you can always come and talk to us what kind of procedures you might need when you wanted to do the financing. It's just that I just wanted to highlight it here. For oncology, we only cover 3 things at the moment for cancer patient, breast stage 1 and stage 2, and also oncology. The diagnostic. Okay, so the rest for oncology treatment, we still yet to be confirmed. So the rest we did not mention. Yes, we can cover. So talk to us so we can really understand what kind of treatment you're going for.
So I think it's a good combination to have, because these patients clearly they need it. They need the treatment, and if they don't have the money upfront, then that's where the needs for the money upfront is met by medical financing like Amden Capital. So I think it's a very good option, which we didn't have it before.
Yes.
And it's important for the health professionals to work together with your type of finance which you provide, because there are the traditional medical insurances, they only provide for certain problems, medical diseases. So they don't provide, they are yet to provide medical financing for or insurance coverage for these procedures, which they consider aesthetic. But actually it's not aesthetic. If you look at it, because it is obesity and metabolic syndrome. It's a serious disease, in Malaysia, and it's the highest within the Southeast Asia countries. So it has to be addressed as a disease, and it has to be treated as a disease. However, until the medical insurance boards they come on board with this, because the long-term implications are there. The financial burden to the government and to themselves as well. So yes, Amden Capital is good.
Yeah,
to
that's
come.
why we are here. Actually, we wanted to really give alternative options for the patient to get the treatment. Like you mentioned, Dr. Theeva, yes, actually, if I'm not mistaken, in Malaysia, considered as among the highest for the obesity problem and considered it is still under aesthetic. So that's why for with Amden Capital, you can get the treatment needed. So we can help you to pre-plan whether you need it to very fast within a week, because we can give you the disbursement within a week. So come and talk to Amden to know more about how we can really help you to get the treatment.
So in terms of cost, there are many ways, okay, for the patients to cover the cost. One way is, of course, with Amden Capital, okay, which provides medical financing. The other ways is, if it's done in a government hospital, the options for the patients would be through claim, but it's pay and claim, yeah, through JPA, okay. EPF, okay, you can take out upfront money from your EPF account too. We just need to fill up the necessary documents. For Muslims, you can potentially claim from zakat. Also depends on the documentations provided by the healthcare professional.
Okay, for Amden Capital, we are actually the dedicated medical financing service provider in Southeast Asia. So how we can really help is when you come and talk to us, we can understand the situation. So that's how actually the options that we can give is also according to your background. If let's say you are not eligible according to our list, we can suggest to your immediate families to take it. So perhaps your spouse, even your parents, your siblings, or your kids. So yes, so actually the options are huge. You can talk to us, although you are only a housewife, do not worry about that. We will find out. Like we say, medical financing from us is more to emotional financing. We really want to help you. Talk to us first.
What I would like to say is, bottom line, don't be afraid to ask for help. Yeah, it is a serious disease. It is going to have serious implications, both health burden, financial burden, and it affects us as a whole. Yeah, obesity, it gives huge amount of stress mentally, physically, emotionally. Yeah, and it affects the functionality of the person day to day. So don't be afraid to seek for help. That's the first step you can take. And we health professionals, we are there as a team to help you from this rut. Okay.
From Amden Capital, medical financing, consider this as an investment for your health. Okay, do not think that when you need to spend money just to be better and you think, oh, I just spend for nothing. It is for your health investment and for your future. So please seek help, talk to us, talk to the team for you to know and understand more how you can get a healthier lifestyle. So reach out to us.
Yeah.